Good morning or good afternoon, wherever you happen to be joining us from. And welcome to the Healthy Aging Core webinar, The Case for Engaging People with Dementia in Community Support Efforts. My name is Barbara MacLennan, and I'm Provincial Community Engagement Coordinator for United Way of BC's Healthy Aging team, and I'm very pleased to introduce this valuable learning event. I'd like to begin by recognizing that I'm speaking today from the traditional and unceded territory of the Musqueam, Squamish, and Tsleil-Waututh First Nations. And as this is a pan-Canadian webinar with participants from all over the country, we also acknowledge the traditional and ancestral territories of all First Nations on which we gratefully work and gather. Now, to manage the session and ensure good audio and visual quality, there's a few details that we need to point out. Everyone but the presenter will remain muted and cameras will be off. Please feel free to introduce yourself and where you are joining from in the chat box. You can also post questions there or in the Q&A area. And at the end of the presentation, we'll have some time for questions, but please indicate who you are directing your question to. Also, this webinar is being recorded. We'll be posting it on Healthy Aging Core, both BC and Core Canada, in the next couple of days, as well as making the slides and handout available there. If you haven't already signed up for the Core newsletter to make notification of these resources really convenient, then you can do so at the bottom of the homepage. So today's webinar is based on a workshop that was presented at the Provincial Summit on Aging in British Columbia last April. And it was met with such significant interest and is such an important topic that we wanted to bring it to a wider audience. The Building Capacity Project aims to enable people living with dementia to participate in community life as full social citizens. Using a bottom-up, asset-based community development approach, the project works to foster inclusion and reduce stigma by creating meaningful opportunities for people with dementia to remain active and socially connected. So I'm very pleased to introduce our moderator for today's session, Heather Neal-Furneaux, and Heather will introduce the other presenters. Heather's role is knowledge translation and communication for the project. She is a teacher, a writer who's been widely published in newspapers and magazines across the country, including the Globe and Mail, the Georgia Straight, Elle Canada, Vancouver Magazine, and many others. And besides arts and education degrees, she holds a Master of Fine Arts from UBC and is really passionate about storytelling as a vehicle for human connection and social change. So without further ado, I'll turn it over to you, Heather.
Thank you so much, Barbara. Welcome, everybody. So happy to see you today. I'm going to put a slideshow up myself. Something to share here. Bear with me. Un momento. Okay. There we go. All right. So really happy to be here with all of you today and to come together to speak about this work. The Building Capacity Project is work that's happening in two sites. One is in Vancouver, on Vancouver's west side, the traditional, ancestral, and unceded territory of the Coast Salish people. And the other site is in Thunder Bay, the northwestern region of Ontario, the traditional lands of the Anishinaabe Nation. This is a project that is 4 years in length and hopefully much longer. It started in 2019 and goes through to 2023. It's funded by the Public Health Agency of Canada, and it's part of Canada's Dementia Community Investment to raise awareness, reduce stigma, and promote inclusion and the well-being for people with dementia. We are here and we're going to share what we've learned and how we're doing it. But this is going to be more of an interactive type workshop in keeping with the way that we work. It's very collaborative, it's very community-based. And so the first thing I'm going to ask you to do, you already have a job, everybody. Your job is to put in the chat where you're from, where you are, and what your connection is. Are you a community worker? Are you, is this a personal connection for you? What brings you to this workshop? We'd love to hear from you. Okay, so while you're putting that in the chat, we'll just tell you a few more things. We want you to listen to the speakers. They're going to have some conversations, and we're going to put some reflection questions in the background for you to be thinking about while we're speaking, so that you can be thinking about that in relation to what's being spoken about, and add some things in the chat. And we're going to open up the conversation for you to join us several times throughout, so that you get a chance to give us your thoughts as well. So we would really welcome all of that. At this point, we're going to open it up to Dr. Alison Phinney. She is the project co-lead. She's a researcher, a professor, and she's the director of the Center for Research on Personhood and Dementia. She has spearheaded many different research projects and is a very progressive thinker and a community leader. She is an inspiration to all of us, and she's always lovely to listen to. So without further ado, Alison, it's all yours.
Thank you, Heather. And hello, everybody. I should make my, oh yeah, okay. Now I can see more people. I've just made my pictures bigger. So yes, I'm Alison. It says on the screen that I'm a co-lead. I do this work in partnership with Elaine Wiersma, who is our other researcher on the other side of Canada. So we're really the two academic leads. And I do want to take a moment just to tell you just briefly who else is going to be part of the conversation this morning. Mary Jane MacLennan is the chair of the Council of Senior Volunteers, who are part of Vancouver's Westside Seniors Hub. Dr. Andréa Monteiro is joining us. I have to say it, Andréa, you're joining us from Brazil today, sunny Brazil. Andréa, along with Carlina, Marchese, and Bailey Van Dorp, are really the people on our team who work most closely with the community groups and organizations who are involved in the project. And Bill Heibein is a person living with dementia. He is, I think, an original founding member, I might think, of the Northwest Dementia Working Group in Thunder Bay, and has been an important partner from the very start with this project. So we're going to begin with Mary Jane, Bill, and myself having some conversation about the project really as a whole. And then we're going to pass it on to Andréa, Carlina, and Bailey, who will share some of the work that's been happening on the ground with our community partners. And as Heather explained, we will be having, we'll be opening up some space for everyone to have some conversation, to offer comments and questions along the way. But before we get started, I wanted to provide some context for this. So I'm going to share with everyone just a 2-minute overview of the project, just to build a little bit on what you've heard already. And as I speak, I want you to be thinking in the back of your minds about the following question. What opportunities do you see in your context to make the community more inclusive for people with dementia? This is the question that has been sitting with all of us for the past 3.5 years. So as you've heard, the Building Capacity Project is taking place in 2 cities, Vancouver and Thunder Bay. And in each place, we've got this small team, very small team of university researchers who partner with a grassroots volunteer-led community group. So in Thunder Bay, it's Lakehead University working with the Northwest Dementia Working Group, who are an advocacy group of people living with dementia and their care partners. Here in Vancouver, UBC works with the Westside Seniors Hub, and that is a group that really exists to connect local seniors and the organizations and programs that support seniors across Vancouver's Westside neighborhoods. So we have 2 working teams, and we work together as well. But those 2 working teams are reaching out locally to support existing groups and programs, really, I'd say, to do more and do better, just in terms of engaging people with dementia through involvement in community activity. That's the focus. And as you've heard, we're using the approach of asset-based community development. So what this means is we're not offering kind of pre-made solutions for communities, but rather are working from the ground up, building on existing strengths within the organizations and the communities. So we have community coordinators, Andréa, Carlina, for example, who work directly with these groups, fostering connections amongst them, helping develop ideas,
in these groups, helping groups overcome barriers and share insights with each other. We want people with dementia to be connected and contributing in their communities. So ultimately, it is about shifting a paradigm for our communities to see dementia inclusion as part of what we do. It's not just one more thing off the side of the desk, and to be working with people with dementia. So now, how about we have some conversation? I'm seeing Mary Jane and Bill here. I'm going to start by asking a question. So if we remember the three of us back to that time when everyone came from Thunder Bay to Vancouver, we decided at the beginning that we would all get together. We refer to this as our launch event. It was late February 2020. So everyone think about that for a moment. Obviously, it was a great time, but things didn't unfold as we expected. And yet, here we are, 3.5 years later, and in both Vancouver and Thunder Bay, there are more opportunities now for people with dementia to be involved than there were before. So my question, from your perspective, what have we learned about this question? How we can approach advocacy for people with dementia in a positive way? And I don't know if Bill, do you want to go first, or would you like Mary Jane?
Sure. No, that's fine. I think a big part of this goes back to the stigma that's applied to this diagnosis. I also think it goes back in many cases to what you're told at the time of diagnosis by the doctors. The indication or implementation seems to be immediately, you don't have the capacity to be involved in a lot of these things. And to me, someone who has a diagnosis, the more we can be seen active in this type of research, in community projects, et cetera, I think it helps to change people's approach to the stigma of this, but it also will add some benefit, shall we say, to anyone with a recent diagnosis, not necessarily believe the doctor, but to get out there and keep active.
Great point, Bill. I think that's a fundamental learning that I've had and that we've had here in Vancouver through the Westside Seniors Hub involvement in the project. I think just to go back to where Alison began, I think one of the key starting points one of the key learnings is to recognize that this work takes time. And that's not just because of the pandemic interruption that we've all lived through. And some days it feels like hard work, but to begin with the assets that are already in the community level is a great starting point. And then to do, as you've said, Bill, recognize the way that we can use those assets differently by adding the voices of people living with dementia. And in the case of Vancouver, where we have 20 partners in this Westside Seniors Hub, to add the voices of people living with dementia to the experience base that those 20 partners have in working with seniors on the west side of Vancouver. And that community asset-based community development model, really, Alison, was one of the key reasons we were so enthusiastic on the Westside Seniors Hub to become your official community partners, because our values in the project and the founding values of the Westside Seniors Hub Coalition with our partners is so aligned. So early alignment, look for people, organizations whose values are aligned, and then absolutely search out and find the voices of people living with dementia to add them to the conversation.
I think the other thing too, Mary Jane, was the approaches of Thunder Bay and Vancouver were so different. Vancouver was more of a top-down approach. This is what we think you really need. In Thunder Bay, it was more an approach of, they came to people with the diagnosis and said, now, what do you think is best for you? But the two groups combined just meshed, and it's worked out beautifully.
Yeah, some of our greatest early learnings were at that launch event when so many of you came out from Thunder Bay to Vancouver, and we listened to you came to know you as colleagues and collaborators, and really lived through that day and a half event, the value that can be added, and our partners that also attended that event recognized that from the beginning. Not to say it was easy to draw people out into roles working with us. I mean, every organization struggles to find volunteers at this stage. And we knew that if we listen to the stories of people living with dementia, on the Westside Seniors Hub, we see one of our roles to be to amplify those stories and those voices of people living with dementia. One of our strengths of our coalition is that no partner needs to reinvent a wheel here. We see our role to, if you will, amplify the voices that individual partners hear from people living with dementia across our coalition and to the wider community. So one of our learnings has been that storytelling is really important. And we're looking at more and more creative ways to tell those stories. With the communication channels that are open to us today, those voices can be heard far and wide. And so we see that as part of our role to get those messages and out into the community.
I knew this would happen. When we were planning yesterday, I kind of quickly commented, I'm looking forward to today because I know I'm going to learn something, and I always do. And, you know, it's a case of learning things you already knew, but really appreciating it in a different way. One thing I'd like to comment is what I'm thinking about right now is how that asset, like using the strengths you have, where you have them, really happened from the beginning with this project at really a very high level, because I had these kind of vague notions of what I thought might be interesting to do in Vancouver, but I also knew or thought that we didn't have the strength on the ground in the way that you described, Bill. But I knew Elaine way off in Thunder Bay, and I knew she did. So that's really, this project has been this partnership all along. Like you said, the two communities are very different. I think I had some crazy vision that we might become more alike. And of course we've not, but we have drawn on each other's strengths in interesting ways. And what I would add is over the last 3 years, that strength on the ground of people with dementia who want to contribute has evolved here as well. And in many respects, because of what we've learned by working with the Northwest Dementia Group. So, you know, we now have folks here in Vancouver who have contributed, coming together in partnership with some of the organizations to provide some guidance.
Yeah, the project has really initially helped us and our partners make contact with people living with dementia, and to have those voices present at all stages of the discussion is really important. You know, whether you're assessing whether those partners, our partners in the hub, are assessing the needs of people living with dementia in their community, whether they are adapting existing programs to be more dementia friendly, or whether they're designing new programs. At each of those stages, what we've learned is those voices need to be present, and not just at each stage, but leading those conversations if possible, and wherever possible. You know, the people living with dementia that have participated in those stages have really helped us stay focused and taken conversations forward in ways that we never would have envisioned at the beginning of the project. So huge learning for us as a council of seniors, and I think for the experience across our partners that include municipal libraries, community centers, not-for-profit, churches, neighborhood house, and senior centers. So that diversity that learning has been spread across the diversity of those organizations that work with seniors. So invaluable to see right from that launch event and live through the early years of this project, what a difference those voices make. Bill, I'm reminded of your colleague, our colleague now here in Vancouver, Myrna, who always says, and this rings in my head every day, nothing about us without us. And that really rings true always in every conversation I've been part of.
Oh, yeah.
I think we've got another minute or two. Okay, have I lost my question?
We have pills for you.
Yeah, maybe I need it. Oh no, I know what it is. It is one of the very first things you said, Bill, was about being seen to be active. It's that idea of being seen and being visible. And you know, one of the prompts that I have here, because it's important, it's not easy doing this work, connecting with people with dementia. And we often talk about the challenge of finding people who are willing and able and eager to be engaged. But I think I'm feeling better about that, being reminded it takes time and it takes visibility. Maybe my question might be, we worry sometimes, this is our full disclosure webinar, we worry sometimes that it is that we rely on the usual suspects, that it's often the same people that we go to when we know we're surrounded in our communities by people with lived experience of dementia. And I just wonder, Bill or Mary Jane, do you have any thoughts about that?
There's also a selfish aspect to this too, Alison, in that by participating and being and hearing from other people, or being around and hearing from other people with a diagnosis, I like to hear what they're doing, what works for them, because I'm possibly going to learn something that will benefit me in the long run. So it's a two-way street here.
Absolutely. Bill, you mentioned stigma earlier too. I mean, I think stigma, misunderstanding, and fear hold all of us back in this work. And I think, you know, education and training can help, but they're not all of the solution. So to, you know, what we've learned is that to use all kinds of avenues to reach out, because it's been a challenge, as you say, Alison, to engage people living with dementia in the project. But we're now using social media. We've done advertising in public transit, ways that social media can help support us in the work, to tell the stories to help get over the stigma, and therefore diminish the fear for people to come forward, whether we're living with dementia or not, to become really partners in the work. And I mean, for me, when all of us have the confidence to reach out to friends and neighbors that we know are living with this, then we'll know that we really are well away along the path to creating dementia-friendly communities, when that stigma can be gradually eroded and we all have a confidence to invite people to join us in the work, really.
But
Yeah, I would, a member of our action group here in BC is Granville Johnson, who lives far up north in a small community. And he has spoken about that in a way that again, one of those things I kind of knew, but I understand it better now. And that idea of this is something that we're all afraid of. And it isn't about not being afraid anymore. It's about choosing to move forward in a good way. That idea of moving forward in a positive way, and just and being with that fear and recognizing that. But it's not a reason to exclude people.
so much of that, Alison, gets back to that. You were told that you simply did not have the capacity to do that any longer.
Yeah, and told by very powerful voices. You know,
You'll hear just little offshoot here. The band that I play with, our piano player, who's now retired, but he was a medical doctor. And when I was diagnosed and told the band that I'd had the diagnosis, one of the first things Peter said, well, don't pay any attention to what you're told by a doctor. So go from there.
I love that, Bill. I love that. I absolutely love that.
Well, coming from a doctor, I figured, what the heck?
Yeah, no kidding. If it's coming from a doctor, good point. Good point. Wonderful. I'm loving this discussion, and I want to invite the crowd to join us in this discussion now and give us some thoughts and feedback. I was just thinking when you were speaking earlier, Mary Jean, about the two different sites and how they'd come at things differently. Just about how, you know, we're breaking down silos and there's this connective tissue that's happening. And even if we have different approaches, we're coming together with those different approaches, and we're using the assets we have through different lenses because of our connecting with each other. So it's nice to see that happening, and it's nice to see the way that that's modeling for us what we need to, like, getting rid of silos. Next goal, getting rid of stigma. Let's shoot big. Anybody have comments from the crowd? I'd love to hear from you. We've got a little bit of time. I can't see everybody, so I don't know quite how. Maybe Barb, you can let me know how I can see when somebody's, or do we just want people to speak up perhaps?
Yeah, I think if people put things in the chat box, or if there's not huge numbers, if somebody does want to unmute and jump in, if that's easier, that's okay too.
Yeah, you know what? If we have smaller numbers, I would love for you to unmute and jump in. We'd love to hear from you. Who you are, why you're here, some thoughts on what you've just heard, your stance on listening to doctors, not listening to doctors. Just kidding.
I'm looking at who's here.
I know.
It's
I
really
see
nice to
Jasmine Rockwell's here, and Lynn Shepherd's here. And I noticed in the chat that somebody mentioned that they're from Colombia. They're not in Colombia, but they're from Colombia. Let's see here. She's studying, living in New Westminster, a gerontology student. Fantastic. And Jasmine.
Actually, Heather, I'm here because Alison waylaid me during a conference in Waterloo.
This is true.
Heather, I was just reminded by Gemma that other participants cannot unmute themselves.
Okay.
So if people, put something in the chat or in the Q&A, then that's better, because they can't jump in.
I was starting to wonder. There's a little silent over here. Crickets. Okay. All right. Does anyone have any thoughts they'd like to add to what you've heard so far? Questions for some of the panelists at all?
I actually have one. We've been really interested in the dementia-friendly communities initiative, and just wondering about connections with that and how widespread that is becoming.
Anyone want to take a stab at that?
Well, I'll speak for Vancouver briefly. I mean, we certainly follow that. We're fortunate to live in a city that has declared itself to want to become more dementia friendly. We certainly see the Alzheimer's Society of BC as one of our collaborators. They're a big organization. It's taken us a while to figure out exactly how are the best ways to collaborate with them, and we still work on that, but they're definitely one of the assets in the community to tap into.
Thanks, Mary Jane.
I've got a note in the chat here from Lynn Jackson. It says, I had a great doctor who, after my diagnosis, told me to get my affairs in order because I love to travel. Because I love to travel, he said, your treatment's very portable, so put your medications in your carry-on and away you go. I have friends who love to travel, so I took his advice and I've traveled the world. That's awesome. Absolutely awesome. I'm a traveler too, Lynn, so I hear you on that one.
So be visible not only in your own community, but around the world. And we know, Lynn, that you have done that. Yeah.
That's amazing. Yeah, that reminds me of something Granville Johnson said recently about, taking the diagnosis that you have and shifting the perspective from getting your affairs in order to making the most of every single moment and enjoying every single day and feeling wonderful to be where you are and be alive. So there's a lovely rhythm to that.
There's another question in the chat box now from Kim. She says she's been working in the dementia care field for over 30 years, and we're still talking about stigma, fear, and unfortunately, physicians who say what they say. How do we accelerate acceptance and reducing stigma?
Can I jump in?
Yes, please.
Okay. Yeah, I'm right there with you, Kim. I've been doing this work since, so it's been 30 years. And I thought when I was going to do a PhD, I wanted to learn about people's experience of living with dementia. And I chose that because I was curious. I thought as a nurse, I thought this was something important we needed to understand. And moreover, I thought it was a strategic decision because the population was aging. There was going to be work to do. And indeed, I've never been without work. I thought people would jump on board faster. I really did. And it's just dumbfounding to me to see, as you do, that that we're still talking about the same things. I'm going to say two concrete things. One is some of the work that we're hoping to do next here in Vancouver, specifically, because there's a potential pot of funding that we can get at UBC, is to target the students, the medical students. So this is medical students, nursing students, the people who still say what they say. I like that phrase. Going to bring them together with people with lived experience, those students, to have some conversations about how we can do education better. I'm hoping we'll get that funding. So it's kind of going to some of the roots of that. But I would also say that I remain ever hopeful. I think we're at a turning point and I think maybe it comes from more visibility of more people with lived experience, because it's very hard to continue to feel, to be immobilized by stigma and fear when you have people like Bill and Myrna and Lynn and all those people in your face saying enough already.
Yeah, and I just wanted to add to, Carlina just put in the chat that there's also the dementia friendly language guide that has been created as well. And so it's, we talked about this a few weeks back as well, that there has to be a balance between, here are some training tools, some resources like a dementia friendly language guide, or the Flipping Stigma Toolkit, which is another online resource that we've been using for training sessions. But that has to go in tandem with hearing from people with lived experience. If you're just doing the training and you've had no experience speaking with people that have experience, that's, you need to do more kind of thing. So we've got another question here from Denise Bryson, or sorry, more of a comment. I think the lack of education to people in general causes the stigma. The lack of understanding of all the different dimensions and types of dementia makes people think that people living with dementia cannot be part of that decision making. Yes, absolutely. More community collaboration is a great way to go. I've been a nurse for over 40 years, and like you say, we're still fighting the stigma.
Heather, if I may add one thing,
Yes.
Alison knows Nisha Sutherland quite well. Nisha is a professor of nursing at Lakehead University here. Nisha and I have done a number, and will be continuing to do, presentations to the 3rd and 4th year nursing class at Lakehead University. And in many cases, the people, or the students that we go and talk before, their only knowledge of dementia is if they happen to go into a seniors or a nursing home and to see people in advanced stages. It comes as a shock that I can carry on a conversation with them.
Absolutely. Yeah, no, that's the reason they need to see more people in community with dementia and understand that piece. Absolutely. We have another question here from Jasmine Rockwell, who works in gerontology at Langara College. She said, do you have a sense of how your project is going to be used to inform the national dementia strategy going forward? Alison, I'm looking at you.
Yeah, I'll just briefly say, I do not, I said this yesterday too, like I could think of myself as a bit of a cynic, but I'm feeling positive these days. Having just come from a meeting in Waterloo where there were representatives of the first 20 projects that received funding through the Dementia Community Initiative with funding from the Public Health Agency, which is like, we're one of those projects. It was very exciting. It was a really positive thing to see how that is building some capacity across the country. I think that focus of the funding on community and doing things from the grassroots up, like we're not alone in this work. I think that will have impact moving forward. That, you know, the dementia strategy, there's been a piece around supporting well-being and reducing stigma. I think just really generally, we tend to think of dementia as a healthcare issue. And with this funding and with this work, we're reminding that dementia is not just a healthcare issue. It is an issue of how we are to live in community with each other. And there's work happening right across the country. We are a country of pilot projects. They risk being lost. So I'm grateful for opportunities like this. Barbara, I'm looking at you, like really, this kind of national platform to share some of this work is really important. And yeah, maybe that's what I would say. I don't know.
That's wonderful.
I don't know. Anyone else?
Yeah, we have 2 more comments, and then I'm going to pass the torch to our next presenters. So the first comment is from Lynn Shepherd. Grassroots social service organizations focusing on providing seniors programs can include some dementia-friendly training in their orientation. Absolutely. There's an online Flipping Stigma toolkit with voices of people experiencing dementia, and the Alzheimer's Society of Canada has dementia trainings online as well. So if it's not feasible to have a local advocate participate in orientations, these tools can be incorporated into orientation discussions. So staff have been introduced to the language and approaches. The Flipping Stigma has the voices of people with dementia speaking and telling their stories, which is a wonderful, wonderful resource. And then we've got a comment from Catherine. Hi, Bill started his response by talking about the diagnosis and the way it's given to people. I'd like to know, if possible, how is the process previous to the final diagnosis, talking about medical or neuropsychological testing, and if that process is also overwhelming. Does anybody want to take a stab at that before we move on?
I just comment on the training, the earlier part. Absolutely, the experiential piece is an essential complement to the training. And while the training can take us so far, there's that confidence piece we talked about earlier on. I can give a really good example from Vancouver where one of our partners was training dementia buddies, individuals in their volunteer group who would accompany individuals in programs. They looked at that, experienced it a bit, and made a wonderful decision to say, every one of their volunteers, no matter what they're participating in their seniors programming, will in fact have training on dementia. And I think that's even been extended to the volunteers and the staff that are working and hired in their childcare programs as well, because they will encounter grandparents like myself that pick children up from daycares, from school. So that extension to the broader community, so that it's really, as Alison says, it's about how we live in community together.
Yeah.
Yeah.
Beautifully said, Mary Jane. Thank you. Bill, did you want to respond at all to the process of diagnosis leading into a final verdict, I guess?
I've heard a lot of people who've had problems getting to see doctors because of the diagnosis, or just the way the whole system is delayed. I never had that problem. I'll tell you why in a minute, but I never had that problem. My family doctor was a neighbor of mine and a client of mine. And when we realized that something wasn't right, he immediately ordered all the testing. I got super service to get the results of the testing. And when I think back now, I'm sure it's because David didn't want someone with a possibility of dementia doing his tax work. And I've always been convinced that's the reason I got such good service. But really, I had no particular problems right up to the time I got the final diagnosis from the doctor. And at that particular moment, the doctor simply stopped talking to me and started talking to my wife.
Yeah.
And really remind me, how many years ago was that?
That diagnosis, that was in January of 2000, 23 years ago,
Amazing.
at which point I was given 5 years.
Wow. Okay. Crazy to think if you had listened to the doctor.
Well, in all respects, I was very lucky. We owned a farm. I had 3 of my mares due to foal within 3 months of my diagnosis. I had no time to feel sorry for myself. I simply went full time into the barn. And if you talk to the horses, they couldn't care less. Just where's the hay?
Yeah. Wow. Wow. Thank you so much, Bill. Okay, I would like to just be conscious of the time. I'd like to move on to Andréa, Carlina, and Bailey. So I'm going to put the PowerPoint back up. They are at the community level going to speak a little bit about the community programming. So this is the question that we're going to put in the background for you to think about as you're listening to them. What assets are already in your community that you could make use of or collaborate on? And I'm going to hand it over to Andréa now, please.
I'm going to continue this lovely conversation because really what I was going to touch upon has been already mentioned in the field through. So again, I'm on the ground. I'm with as a community researcher, research coordinator. And Mary Jane has mentioned, we work alongside the Westside Seniors Hub, just giving that context again, both Alison and Mary Jane has given, but just to contextualize the 2 examples that I'm going to be giving. Some of the partners that work alongside the Building Capacity projects are Senior Center, Residents Association, church, a neighborhood house, a community center, a seniors daycare, and the more informally, the local library as well. So as Bill has touched upon throughout these last 3 years, a lot of work has been done with some of these groups, and stigma was a big piece. And through this last cycle, beginning in March, things started to really flourish. And I want to give a glimpse of some of the work on the ground of this living organism that is all those organizations that have really unique questions where they are. I'm going to highlight something that was touched upon was the neighborhood house, some of the initiatives that they've taken upon, and to move forward the work on awareness at the community level around dementia. So Mary Jane has also mentioned the training, the staff, and it happened last month. They launched on the fall a full let's talk about dementia awareness. And that training had happened in the beginning of the pandemic already. And this time around, they're just able to move things a bit further because of the social distancing piece. And in this training, we used the Fleeting toolkit that Heather mentioned as well. And we had a facilitator and an advocate with expertise and lived experience, Lynn Jackson, who's also here. I saw your name, Lynn, big shout out. That was such a fruitful conversation. We had this workshop that for 2 hours, the entire staff were present and that they were able to bring personal issues and professional issues and just really think about how can those conversations can carry on at their daily work. And the staff that worked all across childcare through seniors work. Another piece of this initiative for the neighborhood house is that this fall they are recruiting That's another thing that they've intended to, and that they are really moving forward now in the fall, recruiting folks in the neighborhood with lived experience to create a focus group to inform their programming, their daily living, what they would like to see happen in the community, really making that link. And that's when having an event like the ones that have been mentioned and having Lean there, for example, and having Grandview that just last week came virtually from Prince George to drum during their seniors lunch, having that visibility. The hope is that it will inspire others in the community to tackle the stigma piece that we've been mentioning here. Mary Jane also mentioned the volunteer buddy that they've had, and their next step really is to move this conversation to the broader community and to the business in the neighborhood to sort of amplify those voices. And the other one that I will briefly touch, and I hope I'm looking at you, Heather, that I have time. It's just another. It's a new partner that came into the Building Capacity Project in the Westside Seniors Hub this past March. It's a local church. They are bilingual. Some of the questions that they came with were, what does cross-cultural conversations about dementia look like? And for them in particular, they are Mandarin and English congregation. They wanted to explore who is an expert who can talk about the dementia. The other question that they came with was, how do we tackle long distance caregiving when a loved one is diagnosed from afar? So they have and family members are so far away, they're being diagnosed. How do we deal with that? So they have now in November 2 workshops, bilingual, fully in Mandarin and English, supported by the Alzheimer's Society DC, and those are the examples of how is this lived on the ground in which communities who have very unique questions to their organizations, to their neighborhoods. And I suppose I'm passing it on to Carlina and to Bailey to continue.
Thank you,
What's Thunder Bay looking like?
Thank you so much, Andrea. Bailey and Carlina.
Hi, everyone. So on behalf of Thunder Bay, we're just going to talk about a few initiatives in our community. So we have the Northwest Dementia Working Group. So this is an advocacy group in Thunder Bay, works within the community to create positive change for people living with dementia, as well as care partners and others surrounding. So the main focus of this group is the inclusion of people living with dementia, also influencing public policies and services, promoting education and awareness of dementia through voices of people who have dementia, and as well as challenging the stigma around dementia. So the advocacy group meets about once a month to discuss any upcoming events, as well as any initiatives to address and take action towards, as well as collaborating with other organizations for further awareness. So another initiative is we have the Dementia Cafe at the Urban Abbey in town. So the Urban Abbey is a community space and also a church. So at the Dementia Cafe, we have coffee and tea and some treats that are provided. It's a very welcoming space environment for people with dementia, as well as care partners and anyone else who wants to join for the afternoon and learn more about dementia to become more involved. So I'll just pass it on to Carlina.
Thanks, Bailey. Also mention the Dementia Sisterhood, a bit of a spinoff from the working group for the women. And so that's a virtual group of women living with dementia, and they meet on Zoom with a facilitator, Elaine. And so it includes women from across Canada, not just specific to Thunder Bay or Vancouver. And they meet online and discuss about their lives living with dementia as women. Some of the other partnerships we've created in the community is a partnership with the Thunder Bay Public Library. So the Northwest Dementia Working Group reviewed the collection of books on dementia at the library. And one of the working group members actually used to work at the library as a library tech. And so this is just an example of using some of the assets that we have. And so this was right up her alley. And so she really took the lead on reviewing the list of books that the library has and suggesting, to update or retire some of the older titles and make suggestions for new books as well, and identifying gaps in the collection, such as books written by people living with dementia, or books regarding different types of dementia like Lewy body dementia, or children books as well. So that worked out very nicely, and the library was so very appreciative and was able to update their collection. Another partnership was with the Thunder Bay Museum. And so what we did with them was a few sessions of a program for people living with dementia. So it included a tour of the first floor of the museum, which is all about Thunder Bay history, including how the city was built, and a silver mine that used to be nearby called Silver Islet, and then a reminiscing activity for people living with dementia, based on artifacts from the city, including some of our old hotels and shopping centers. And so the Thunder Bay Museum already had the reminiscing program in place that they would do for long-term care homes through their recreation therapy program. However, we were able to adapt it for this program, and then we also extended it to the Dementia Cafe as well. And so we had someone from the Thunder Bay Museum come to the Dementia Cafe and do a bit of that reminiscing with the Dementia Cafe group.
Wonderful. Thank you so much, Carlina. I just noticed something in the chat here. Alison just mentioned that listening to all of these stories is reminding her that we have learned so much about online collaboration and how much that's become part of our world. It's really worked to open possibilities in more places and to connect people from all over the world. It's very, very true. Absolutely. Thank you so much, Bailey and Carlina. We have a little bit of time left. I want to open up the space for questions. Just for a few minutes, if anyone else had any comments about what you've just heard. So exciting to hear about all these different initiatives that are happening and how well they're being received. And we do have a monthly newsletter now on Building Capacity website. So if you want to hear about some of these events and what's going on the ground, you can check that out. So that's another resource for you to see. Any thoughts from the crowd?
I've got one comment or contribution on the last question about what are the assets in the community.
Yeah.
I'm not sure if many people on the webinar have heard about men's sheds, which is a growing movement of men getting together. It can be in workshops or just meeting for coffee. Sometimes it's around gardening or cooking, but it really is an initiative aimed at older men, very bottom up, grassroots, in now probably more than 50 or 60 communities across the country, where men can get together and just be with each other, learn from each other, connect, and work on community projects, because older men have a much higher rate of suicide and depression because of social isolation, and often the loss of purpose that can come with retirement or major life changes, widowhood, divorce. Anyway, so a number of the men's sheds in Canada are now doing really targeted and intentional outreach to men with dementia in their communities. So I thought that was a really valuable effort and really in line with the Building Capacity project, because men's sheds are growing in communities across the country. And, one of their fundamental principles is really around being inclusive. And so to see a few of the sheds really being very intentional around finding out who the men in their community are who have dementia and could be part of the local shed, it's quite exciting to see.
That's amazing, Barb. Thank you so much. Absolutely.
That's actually nice to hear because Elaine's group here in Thunder Bay is very sexist. I've been bugging her for years, but she won't let me in.
Oh, Elaine. Oh, boy.
Your comments, Barbara, remind me because you said like the values are similar, and that's really one of the things that I think carries us along in this work. It's finding those points of shared value. This isn't, coming back to that idea, this isn't about doing one more thing. It is in fact about finding ways that we align with things that are already happening. Yeah, it's a good example.
Absolutely. And Denise Bryson just said that they're looking into the men's shed in Penticton, and they're also getting a dementia music group set up there as well. That's fantastic, Denise. Thank you. We have just a few minutes left, and I wanted to give the final word to Bill. Bill, do you have any last thoughts to share with us? Got about 4 more minutes or so, and I just want to hear from you.
Okay, I guess if I had to try and summarize or put my position on this, when you're diagnosed, you're told you no longer have the capacity to do certain things. But so much of that is not true. I think the best thing that a person can do with the diagnosis of dementia is stay as physically, mentally, and socially active as you can do. Don't just sit on a couch and stare at a wall. Don't believe what you're told, that you've only got so long to live. Basically, get out and stay involved. When I was diagnosed, and as I mentioned, I had the horses, which I still have. But I started to think about this actually, and what I was able to do yesterday, there's no reason I shouldn't be able to do it today just because I received a diagnosis of dementia. And if I can do it today, there's no reason I can't go out and do it tomorrow. That's the philosophy I have tried to apply all the way through from the time I was originally diagnosed. And if for some reason I do feel down or whatnot, again, I have a tremendous opportunity, which most people don't have. I can go down to the barn and hug a horse.
That's awesome. Just awesome. Yeah, it's you're very inspirational to me, Bill. That's pretty amazing.
Thank
you. Okay, well, it looks like we're running out of time. I think that there was possibly one more comment here from Gail Manson that I'll just share. She says, the message to all those when a diagnosis is given is that the more socially active, the fuller life you can live. And Bill is a wonderful example. Very true, Gail. Thank you for that. And Denise Bryson echoes that. She just said, well said, Bill. Very true. And Gail Manson also mentioned animal therapy being looked at by a colleague in Alberta. And Kim Greer says, there's a great fundraiser called Hug a Horse, and I need to go sign up for that. That sounds amazing. That's
I have the horse, Heather.
To end this talk on. Such a great way to end this talk.
Come on down. I have the horse.
I will, Bill. Don't test me. I'm coming. Well, thank you all for being here today. It's been such a pleasure to listen to each of you share your perspectives and your knowledge. And thank you to the attendees who came today to listen as well. We're so grateful you came. We will have a recording of this on the website, on the Healthy Aging Core website. So please feel free to share that widely with colleagues, friends, family. And we are so grateful to all of you. Thank you so, so much.
Great. And I echo that appreciation to all of the presenters and to you, Heather. Thank you all for such a valuable insights and the conversation, the resources, everything that you've shared. I think it's really important. And as Heather pointed out, it will be available on CORE, the recording of this session, as well as the handout. Handout's already up there, but the recording will be available shortly, and you can share it. Please forward it. And a lot of people these days are very tied up and unable to participate live in the webinars, but we do really promote them going forward to be shared for different purposes in workshops or just listening to when you have a spare moment. So we really appreciate this. I learned a lot, and we'll continue to learn and continue to look at how we can be engaged more in sharing the insights and resources from this project. So thank you all, and thanks to all of our participants for your great contributions in the chat box. I love being left today with the hug a horse, the image, and the possibility. I'm really excited about that. So thanks everyone for taking time out of your very busy days to be with us. Take care.